Hey, hope you're enjoying your Tuesday. Leah here, Weston Leah, 1023 XLC. I jumped on yesterday to give you guys a little bit of a preview about what's going to be going on this week. It is Suicide Prevention Awareness Month. So this week we are taking on the difficult discussion about suicide because it can be uncomfortable. So I just want to put it out there that this can be a trigger for some people. But we're putting this information out there, hopefully to help somebody that you know, or maybe yourself, but help is available 24/7. I'll leave that number up there. And we are going to be talking to Lake Behavioral Hospital today, who is joining me. Hey, guys.
Hi, how are you?
Doing well. How about yourself?
We're good.
Now we have Cindy, and Cindy, you're the CEO over at Lake Behavioral Hospital, correct?
Correct. Yep, CEO.
And then doctor, introduce yourself.
I'm Dr. Shiraz Bhatt. I'm a psychiatrist and also the medical director of Lake Behavioral Hospital.
Now, Lake Behavioral Hospital is right here. We're pretty much neighbors in Waukegan. You guys have been helping serve the Lake County area for how long?
So we moved into the Lake County area in March of 2018. We're operating originally a 46-bed hospital out of the old St. Teresa off of Washington. And then recently, within the last 3 months, we're able to expand to 146 beds on the same campus in a brand new state-of-the-art building for behavioral health.
I've seen the pictures online, but being right down the street, I can't believe I didn't even know you guys were there.
Yeah, we're on the footprint of the campus, and so everyone knows the building of St. Teresa, and so we're on that campus right behind the big building off of Washington. So we have a large sign right off on Washington. We're here 24 hours a day, 7 days a week. So
that's
easy
awesome.
to miss, but important to be here.
Yes, absolutely. I agree. Now, you and I just started talking last week, but a little bit about myself is that I am super open and candid about my mental health issues because I think that it's important to be that way. And you and I kind of agreed on the fact that we are trying to end the stigma right now that does go along with anyone that is struggling with their mental health, especially right now with the pandemic going on. You mentioned a lot of people may be feeling things that they've never felt before. I know when this all took place, I had friends that were like, so how are you doing? And I was like, I'm good. They're like, wait, what? I was like, oh, I haven't had anxiety my whole life. I've been preparing for worst case scenario for as long as I can remember. Like those feelings I was able to deal with. But for somebody who has never experienced those feelings before, it's a lot different. So can you tell us a little bit about the mental health programs that you guys specialize there at Lake Behavioral Hospital?
Sure. And so at Lake Behavioral Hospital, we serve individuals 13 years and up. We're working with individuals who have serious chronic mental illness, schizophrenia, bipolar, psychosis-based illnesses, to individuals who are managing depression, anxiety, PTSD, postpartum issues, as well as individuals managing substance abuse. So individuals who deal with both a substance abuse issue as well as a mental health issue. We're able to provide all those services at our facility, both on the inpatient side and through intensive outpatient programming, which is outpatient group services. So unlike traditional appointments where you see your therapist once a week or once a month and see a doctor for medication, IOP and PHP allows individuals to come in a outpatient setting, but get that intensive group services that are similar to the inpatient setting.
Now, the telehealth that you guys have, and a lot of people across the board have had to offer, as far as an option, which for me, and for a lot of people, I'm sure it's not ideal. Like I miss sitting down and seeing my therapist.
Sure.
I miss her. I miss that in person. A lot of people need that, but that is something else that you guys do offer there as well.
Yeah, we do. For our outpatient program, we have a hybrid model. So individuals in our intensive outpatient can participate either in person or via Zoom. So whichever they feel more comfortable doing, or whichever is more convenient for them to do, which has been great because we've been able to reach people that maybe weren't able to get here otherwise. So now they can still join us via Zoom, or if their anxiety is a little bit just too much to be able to come in, we're still able to participate in the group services with them through telemedicine, which has been a great addition.
Now, I've talked to a lot of people that have, again, been experiencing some kind of emotion for the first time and not knowing how to deal with it. You know, people are feeling isolated. There's people that are losing their jobs, and they're having trouble getting in to see people. What is that normal wait time for you guys right now, or average, I should say?
So because we do assessments 24 hours a day, 7 days a week, we really don't have a wait time. People can walk in at any point. They can call ahead and schedule an assessment, or they can just walk in and say, I need an assessment. I'm not sure what I need. And so the longest they wait is just the handful of minutes to come back into the intake area so that they can meet with a clinician. We have clinicians on staff 24 hours a day, 7 days a week in our intake department. So they're going to sit down and they're going to go through an assessment with this clinician to determine really what level of care that they need. It might be intensive inpatient services.
Right.
It could be just outpatient, intensive outpatient, or it could be traditional med management and therapy appointments. But the intake clinician will sit with somebody. They take about an hour. A nice assessment, a thorough assessment takes a little bit over an hour. We consult with the doctor on call to make sure that the level of care that we've assessed for is appropriate. Sometimes that's Dr. Butt that we call to review the cases. So we always have access to our doctors as well. And then we make that determination with the patient. So if that means it's our services, we help connect them into our services. And sometimes it's not our services. If it's something outpatient that we don't provide, we then link them and help them make the appointments. So when they leave our assessment and referral, they're going to get both that assessment and then that referral, whether it's with us or with somebody else.
Okay, that's really cool. And again, you said that's 24/7, 365, no cost. That number is right there below, 855-990-1900. If you or somebody that you know is in crisis and in need of finding some kind of help right away. So thank you guys for doing that. Now, as far as the mental health programs go that you guys offer there, what does your average patient look like?
So our average patient, I mean, it's really anybody you see on the street. It's
Right.
any age, it's any gender, any race, any social economic background. I mean, mental illness covers the whole spectrum of any person. So people are coming in with unique needs, but there is no such thing as an average patient because it's really anyone you see. It's looking into the mirror, might be yourself. It might be your neighbor. So it crosses the whole spectrum for everyone.
And that's really the point that I wanted to drive home is that this is normal for anybody to experience. I do remember there being a time where I looked in the mirror and it was me, but I didn't even recognize myself because of the way that I was feeling. So, and that can be scary for somebody. And it does take a lot for somebody to get from that point to making that call. What do you tell people that are kind of in between?
I'm sorry, what was that? What do we call?
What do you tell people that are like in that in between? They know that something is, wrong, something's going on, they're not feeling well, but they're not ready to make that call and say, "Hey, I need help."
It's unique to each person. I don't know if maybe Dr. Butt wants to, tag in a little bit with the patients when he's, talking with them on the units, because for some of these individuals, it might be their first hospitalization.
Right.
So what are you hearing more, Dr. Butt?
I think the first step is an assessment. And I think it really is a very benign process. And it doesn't hurt if you're not sure about what you're experiencing, whether it falls into the category of a mental illness, or maybe you're at risk for a mental illness, or maybe you're just having some adjustment issues or situational problems resulting in emotional symptoms. So whatever the presentation is, I think the first step would be an assessment by a qualified mental health professional. It doesn't have to be a doctor or a psychiatrist. There are other trained professionals who can do an assessment and then guide you in the next step. That next step might be, counseling. It could be referral to a psychiatrist or a more specialized type of a provider.
Yeah.
Without an assessment, really, it's difficult to say what an individual needs.
All right. So in what I was discussing with you guys or not with you guys yesterday, but on my video is the fact that suicide is sitting at the 11th leading cause of death here in Illinois, and it's rising amongst our youth at third. However, the studies find that, 9 out of 10 people who attempt and survive will not go on to die from suicide at a later date. So there are things that can be done. What you guys are doing is what is helping those people. And when we talk about the pandemic and what people are feeling now, have you guys seen an uptick in calls or people looking for help?
Yeah, we have. I mean, for as long as I've been in this field working with individuals with any kind of behavioral health need, it has always been the goal of, getting involved, finding outlets, building those natural supports in the community. Natural supports are very different than our professional supports, but That's always been the focus. Support, get out there, get involved, don't isolate. And the pandemic has done the complete opposite. The pandemic has said, stay back, don't come near anybody, don't go anywhere. And so now we're having individuals who are, isolating, who are even more at risk then. And so, we're going to see this wave now with this pandemic of more cases of people having anxiety, having to now come back into their normal routines. I mentioned a little bit earlier when we were speaking about there's a whole new definition of grief and loss. We usually focus grief and loss on, losing somebody that we loved close to us, where now grief and loss is the loss of a job, the loss of someone's senior year of high school, the loss of someone's sporting events, the loss of, a big wedding. So people are experiencing lots of other losses that have been just unheard of in the past. And so we're seeing a lot of that as well. So we're seeing that increased depression and anxiety of how will I get back to normal? And so there has been an increase of individuals who have come to us with those concerns. And again, like Dr. Bunt mentioned, not knowing necessarily what they need, but sitting down for that assessment to determine, where do I start? How do I stop feeling this way?
Right. One size definitely does not fit all.
No. And so we focus on that individual aspect, so we know that there's not one size for treatment. And so we individualize what we can with our patients so that we meet their needs when they're with us.
And it happens so often where someone, and this is not a direction to any doctor or anything like that, but it happens so often where, someone will go to just their regular doctor and say, I don't feel good, I'm having anxiety. And they're like, oh, well, here you go, this works. And, what I personally learned with that is that kind of medication does not always work with your body.
Sure.
It takes time if medicine is the route that you have to go down to help with the treatment. Doctor, I see you there with all of your notes. Why aren't you talking to us?
No, I think when it comes to suicide,
are you assessing me?
I think what we need to know is that suicide is a problem that affects everyone. I mean, it's a public health issue. And unfortunately, we have not been able to reduce the rates of suicide over the last many years. The rates have fluctuated, but we still have not been able to really control it in the sense that it's still the third leading cause of death in the 15 to 19 age group. It's the second leading cause of death in the 15 to 29 years of age. So it's one of the leading causes of death, and it's preventable. Also, have to keep in mind that for every person that completes suicide, there are many others who attempt. Right. And so knowing what the risk factors are, I think, can go a long way in helping us address this what I consider a public health emergency.
I think that a lot of people would say that it is, and I don't mean to put you on the spot like this, but would you say to somebody who's like, hey, I'm having suicidal thoughts, like there is some type of normalcy to that? I think that a lot of people have that thought come into their head, and it's whether or not for example, I have OCD. So I have obsessive compulsive thoughts. That thought comes into my head and it sticks there. And then I put weight to it. And I think that I actually, like, why would I have that thought? But a thought can just be a thought.
Right. And so again, that's where a good suicide risk assessment is critical, because not every suicidal thought is the same.
Right.
So a lot of people have passive thoughts that could be, a manifestation of a disease like OCD, or they could have passive suicidal thoughts in the context of chronic depression. And assessing what that risk is, what the lethality or the potential of that suicidal thought turning into something more extreme is something that a professional can assess. There is no one single magic, test that we can do. It's a clinical assessment. It's based on past history, which, by the way, is the single most important risk factor. Is a previous suicide attempt is the single most important predictor of completed suicide. But there are several other risk factors. Having a history of a serious illness like bipolar disorder or depression or schizophrenia, having access to means is very important. In males, the number one means is firearms.
Right.
So, having access to a gun, for example, and having suicidal thoughts, that's a dangerous recipe.
Well, and I'm glad that you brought up males, not to go the sexist route, but I feel like women have a lot easier of a time dealing with their emotions and their thoughts that come into their head. And that's why the male gender does struggle a little bit more, right? They're higher up on the suicide.
Yes, so females attempt suicide a lot more, 3 to 5 times more than males, but males complete suicide at a much higher rate. So when males attempt suicide, it's usually by means of a really lethal means, like a firearm or hanging, which almost always results in death. So it's important to know that, absolutely, that yes, not only is it, I think, that females are able to express emotion better, but the other issue is that culturally we do not encourage our boys and males to really approach or open up, and they're less likely to express themselves and reach out to somebody when they are going through depression and anxiety and other emotional problems.
Absolutely. Suicide Awareness Month, Suicide Prevention Awareness Month, and we're having this discussion all week with various amounts of area and local experts. Thank you guys from Lake Behavioral Hospital for joining me this afternoon. Before I let you go, though, I think we hit on a lot of really good information. Is there anything we missed? Is there any final words that you want to let somebody know? I do have the national number up there right now because I know that this can be a trigger, just talking about it. Even just seeing the word suicide can trigger somebody. So that national number is up there. However, you guys at Lake Behavioral Hospital do have that 24/7 number as well for an assessment. I just want to give you guys the floor to real quick wrap it up and get any final words out there for somebody that either is or knows somebody that is in crisis.
I think I would just end with, the support is out there. You just kind of make that first phone call. And we're going to make this process, as scary as it might be, as unsure as somebody might be, we're going to make sure that an individual gets the services that they need, gets the treatment that they need in the most caring environment that we can do that, so that when someone is feeling at their worst, we want to be there to make them feel better. We want to help them kind of get through that period and help them, with some new tools and some new coping skills to be able to manage and be able to cope, going forward. So it just takes that first phone call, and that's why we try to make it as little difficulty as possible to get in for an assessment. That's like where, you can just walk in the front door 24 hours a day, 7 days a week. There's always somebody sitting in that office waiting to hear what someone has to say. So just got to pick up that phone.
And you guys have many therapists and doctors there on staff. That was another thing I wanted to hit on real quick too, is that, speaking of stigmas, I feel like therapy does get that stigma because people will go and try it once and say, oh, it didn't work for me. And you have to find that connection. And if you don't feel it that first time,
sure,
try somebody else. Same thing goes with medication. And like the doctor said, one size does not fit all when it comes to mental health. So I really do appreciate you guys sitting down and talking to me. I took up 20 minutes of your time.
That's great. It's no problem. You know, we're here to serve this community in whatever way we're able to, and so we want to be able to provide that service.
Excellent. What's the website one more time? I don't think that I even put that up there.
So the website is, www.lakebehavioralhospital.com.
Okay. Excellent. You guys, thank you so much.
Right.
I appreciate it. And if we help one person,
Right.
That's what the job is. So
Exactly.
you guys
All right.
enjoy your day.
Thank you.
Bye.
Bye.